week back, I had a young patient. Doctor, I am flying to US on first. Last week, while football, my knee is getting locked. I'll go for an MRI. Doctor, I don't think it is serious. You are doctor or I am doctor. After the MRI report, he only told doctor.
Past decade से लेके अभी तक आपने क्या लाइफस्टाइल चेंजेस देखे हैं ये जनरेशन में कि ऐसा हो सकता है कि ऑर्थोपेडिक इश्यूज इनमें ज्यादा हो रहा है?
One has to sleep between 12 and 3. The person should be, if he sleeps at 3 in the morning and gets up at 9, his digestive system, his metabolism of the enzymes will not be proper.
So what do you recommend for women of my age have a change in their diet so that when I become old, I do not suffer from these things?
There are other group of people who are over. They will observe 1 inch of fat and they will start working out. Those people also land up with some.
The youth nowadays, they go to the gym and they do deadlifts, which I've heard is not really recommended because it can have a bad effect on your spine. Is that true, sir?
Doing this, kadak,
Chiropractic.
the person has become quadriplegia, weakness in both the upper extremities, weakness in both the lower extremities.
Youngsters also nowadays, they all do crash diet. They miss out on a lot of vitamins and minerals which you should have. So do you think they should take supplements? Old age people, they come to the OPD and they say that we have got pain in the back or knee. Is this a sign of aging or is it because of what advice would you want to give to the aspiring orthopedician?
To aspiring orthopedicians, first thing is there should be.
Welcome to DoctorSaab. My name is Dr. Tanya and today we are going to dive into the world of bones, yani ki Haad-vaids. Joining me on this podcast is none other than Dr. Prakash Samant, an esteemed orthopedic surgeon and the head of Orthopedics Department at Patil Hospital, who's here to share his expertise, bust some myths and give a fresh perspective on bone health. Without wasting any time, let's get started with our episode.
DoctorSaab.
Hello sir, how are you?
Fine. Good afternoon, Dr. Tanya.
Good afternoon to you too, Dr. Samant sir. And I'm really honored to have you today on my show. Thank you so much for joining me on this podcast today.
Thank you.
Okay sir, let's start with the podcast. Can you share a bit about your journey into orthopedics and what actually inspired you to get into it?
See, I come from a medical background. Both my father and mother were doctors.
Okay.
And so that intended me that I should become a doctor, being the eldest sibling. So accordingly, I went into medical profession.
Okay.
I did my MBBS and MS Orthopedics from Lokmanya Tilak Municipal Medical College.
All right.
40 years back. That is how I am into the practice.
So you had some kind of inspiration that brought you into ortho, or you just happened to like the subject?
My intention was basically to take ophthal when I was doing my MBBS studies. But during my writing of the application forms, suddenly some mishap had taken in a government hospital. And there was a breaking news that 21 odd patients have become blind after cataract surgery.
Oh.
And that was exactly during when I was going to select my postgraduate form.
Okay.
So only on that point I decided that if this happens in my private, then what will happen? So I decided that I will not take ophthal, I will go for orthopedics.
So that was like your second choice?
That was my second choice.
All right.
But I am happy now.
Okay. Do you miss ophthal?
No, not at all.
Okay.
Looking back, I think ortho is a much better branch
Than ophthal. Yes. Particularly today, I want to focus on what orthopedic issues usually happens in the younger generation, as we are into a lot of sedentary lifestyle nowadays. So orthopedic issues रहते ही हैं सर. उसके बारे में आज थोड़ा बात करना है. I just want to ask you कि in the past decade से लेके अभी तक आपने क्या लाइफस्टाइल चेंजेस देखे हैं ये जनरेशन में कि ऐसा हो सकता है कि ऑर्थोपेडिक इश्यूज इनमें ज़्यादा हो रहा है उसके वजह से?
Yeah. See, basically, if you have to speak about the last decade, so there are multiple issues pre-COVID and post-COVID.
Right.
The striking difference is post-COVID, if the concept of work from home has started, which was not there pre-COVID.
Right.
So this itself has led to a lot of problems, meaning thereby, because you have to work from home, so there are working class, what I have observed, they don't have, a few people don't have a proper table and chair to sit in their house. So those people sit on the floor. They
Right.
will use the bucket and over it they will keep their laptop.
Right.
And continuously they will sit cross-legged on the floor for n number of hours, including having their water, their lunch in the same run.
Right.
The other problem is when you are asked for working from home. So the company, these are the practical problems. The company says, "Arey, you are at home, so work for 1 hour more extra." What is there? Now you are not traveling, so 1.5 hours traveling and 1.5 hours coming. You can utilize and work for additional 1 hour more. So all these things leads to a standstill.
Right.
So the posture of that person is not maintained. Whether he is a young patient or an old patient, it is not maintained properly. So you you assume one particular posture which is not proper for our back muscles. So there are a lot of back problems. One.
Right.
Second issue is, a lot of people nowadays, young people, they complain of pain around the tailbone. That is another issue which was not there before, because people used to move around. Now you are sitting at one place. Third problem is regarding the neck pain.
Right.
So most of the patients come with neck pain, and they will have some numbness or pain in the hands. This is the third major. Back problems are more, and because of the lazy lifestyle,
Right.
and not being exposed to the sunlight and no mobility, so they are more prone for vitamin D deficiencies. Invariably now, people who are having a work from home attitude,
Right.
their vitamin D is grossly insufficient. These are the problems which takes place. Then overuse of the computers. So if you are overusing your computers, but a lot of people get fatigue pains in the hands.
Oh.
And they get numbness because you take one particular posture
Yeah.
where your hand is in a polar flexion.
Huh.
So you are continuously browsing. So this continuous browsing when you are working will not give you any issue. When you are off the browsing and then when you are relaxing, then the patient starts complaining of numbness. I cannot lift my hand because there is no other activity for those 10 to 12 hours.
They just keep their hand in a
One
set
particular
position.
position and they browse.
So because of that, there could be nerve issues or
There can be, nerve issues.
nerve issues.
Yeah.
So, are there any early warning signs that one should know about that could help them prevent that particular problem, orthopedic issue?
See, usual tendency of the young population is what? They do self-medications.
Right.
Most of the things are now available on Google. So if they go on the Google and they scrouge, my muscle is paining, so they will directly go to the medical store. They will buy the tablet, or they will, they will search on the Google which medicine. They will not even take efforts to go out. Nowadays, everything is available on this Amazon, Blinkit, Zepto.
Yes.
They just type from their workplace, and in 15 minutes that tablet is available at their home, which they do Google Pay.
Right.
Only one of the relatives will come and give that tablet to them. So in-house, they will sit there and they will order the medicines. See, previously, now there is a lot of generation gap. Previously blood pressure, diabetes, malignancies, cancer, all was happening after the age of 55, 60. Currently, the cycle is reversed. More young patients are hypertensive than the old patients.
Right.
Okay, now what is the first reason for that? The first reason is there is no mobility. You are working. See, when a person used to walk for 4 kilometers to his office and come back home 4 kilometers, that itself was an exercise for him. So his heart, circulation, everything was under control. Second thing is the working hours. Working hours were previously 8 hours. If you see the previous schedules, why those things were divided? 8 hours work, 8 hours leisure, 8 hours sleep. That is not there now. Now the workload time is 12 hours, 14 hours.
Right.
Okay, come back home late night, eat food, and immediately take remote and go to sleep. Again, get up early in the morning. So the lack of sleep contributes to many things. First and the foremost is graying of the hairs. Nowadays I see youngsters, their hairs are graying at the age of 20 to 23. During our times, the graying of the hairs were taking place after 45, 50. Nowadays, 20-year-old boy, 20-year-old, their hair starts graying. What is the reason? The reason is lack of sleep, insomnia. Second important factor is the stress. See, during our times, mobile was there when I passed MBBS. Okay. Now the distraction modes are too many. Everything is available on one finger. So during our times, even if I have to call somebody in my house, I have to go from my hospital, go down to the operator, ring my landline, then I will speak. If he is not able, okay, I will call you after half an hour. Nowadays, that is not there.
Right.
Stress busters are more. Somebody will call you, will irritate you, he will keep down the phone and you keep on thinking. So these things leads concentration on your mind, which was not there before.
True.
So all these things combined lead to all young diseases. During our times, smoking, I used to rarely see any females smoking. Nowadays, the incidence of smoking has increased in the young females. So that is how I have seen the incidences of cancer of the breast in a younger patients, in a younger females. Previously, it was not like that.
Right.
There were 8 hours duty, come home, relax, go for walking, go with your family. There was no other means. The television in the house used to be for only 2 hours. It used to start at 7 and it used to close at 9. Whereas the current scenario, you put any TV channel on any day, any time, it is on. So people, they continuously keep on watching the TV for till midnight, 4. Then how will you sleep? When will you get up? So because of that, see, the ideal time, when if you know the digestive system, one has to sleep between 12 and 3. The person should be sleeping. If he sleeps at 3 in the morning and gets up at 9, his digestive system, his metabolism of the enzymes will not be proper.
Okay.
That is for sure. So all these late night sleepers who sleep when they get up late then all other activities are late.
Right, huh?
So then you will get baldness, you will get graying of the hairs, you will get a pot belly and no active lifestyle. This is the problems with the youngsters.
Yes, sir. What do you think simple habits that we could incorporate into our lives that could help us be away from such issues?
See, simple things, most important is you have to be mobile.
Right.
Now what happens if you are sitting in the house with a remote? Okay, when I was 24, 25, there were no remotes like that. We have to go, change the channel and again come and sit.
Okay.
Nowadays everything is on one hand. Guide, news, Republic, guide, news, Hindi channel. So you are not moving only. So this is statistics. If a person sits at one place for more than 3 hours, his weight starts increasing. Okay. So if you break that chain, after half an hour you get up, just walk for 2-3 minutes, again sit. So if suppose I am sitting in my chair here, After 45 minutes, I get up, I just walk for 3 minutes or I just stand.
Okay.
So that tends to reduce the weight and I again sit in the chair. So mobility is one thing which should be there. Second important habit is, you must have at least 1.5 liters of water per day, which hardly any people take. Third thing is the breakfast should be more heavy. If a person is working,
Okay.
his breakfast should be heavy. His lunch should be lesser than the breakfast. And the dinner should be minimum. The problem in our country is, in our city problem is, it is reverse. People are usually busy. So morning, give me just 1 glass of milk, I'm going. Office, they will have some this thing. At night when they come home, they will have 4 chapatis, they will have 2-3 bowls of rice.
Right.
And after that, there is no activity. So that pyramid is reversed if you are working for 14-15 hours. So that is important. Lifestyle habits, eating properly in time, getting up properly in time, that is important. Here what happens, I have seen, when is your weekly off? Sir, weekly off is Saturday, Sunday, but I am doing other consultancy. Means again he is back on the computer, again his neck is spraining,
Right.
again his hand is spraining. Stress factors are too many now. That's why all the problems are in youngsters. If you take the incidence of heart attacks in the Bombay, if you take the statistics from the ICUs, you will find age group between 30 and 40, the heart attacks are more than after 50-55. What is the reason? The reason is stress, lack of sleep, junk food, no activity. At the same time, there are other group of people who are over. Means, they will observe 1 inch of fat and they will start working out. Those people also land up with some other problems.
Right.
So there are 2 precautions. I will eat only egg white in the morning, 8 egg whites in the morning. Then I will not have anything. Then in the gym they will go. The trainer will advise them, take this powder, take that powder. So these powders are actually not to be consumed. However expensive it is. 1 teaspoon they advise, tablespoon. Okay, they are expensive, 6,000, 7,000. 1 tablespoon is around 100 rupees. But in the long run, they are all damaging the kidney, which that particular person realizes after 5 years. But then that damage is irreversible. Means if you stop the powder and the kidney will go back, no.
Okay.
So they must focus on good quality food, home food, which is not the thing. Everybody wants to eat batata vada. Everybody wants to eat misal. Everybody wants to eat Chinese. So in Chinese there is one substance, I forgot the name. Ajinomoto. These are all hepatotoxic and this thing. So how your body will remain normal? How your blood pressure will remain normal?
Right.
So sound means home food is recommendable.
So that's what I see in youngsters also nowadays. They all do crash diets.
Yeah.
They don't eat, or maybe they miss out on a lot of vitamins and minerals which you should have. So do you think they should take supplements while they are trying to diet or something?
See, natural food is natural food. What 1 apple will give you, you will not get that with tablet vitamin A or vitamin E. So they must more focus on salads.
Okay.
At least they must consume 1 apple or 1 or 2 tomatoes, kakdi, all the beetroot, these they must consume. These are the natural antioxidants, rather than taking supplements from the medical shops. Natural antioxidants will work better than the supplements which are available. Supplements, when they must take, if they are having any illness, post-febrile, there is weakness, then you have to take B12, you have to take multivitamin tablet.
Right, sir. We will now focus on bone health in women. So particularly women after a certain age, they undergo something called as osteoporosis. Their bones become weak, and sometimes if they slip and fall, they might have fractures and stuff. So, sir, what do you recommend for women of my age to uh, to have a change in their diet so that when I become old, I do not suffer from these things?
See, good question. See, normally, bone formation in any human being, it happens till the age of 30.
Okay.
Moment you cross 30, okay, the calcium starts depleting from everybody's body, including males, including females. The additional factors why females are more prone for osteoporosis is because of the pregnancies. Now, currently, what happens? There are 2 pregnancies in the span of, some women I have seen in 2 years, some women I have seen in 3 years. Some women I have seen, they undergo 2-3 MTPs, then they go for the second child. And some women have become mothers at the age of 19.
Right.
So these women, or if there are multiple pregnancies, these women tend to prone for osteoporosis because their dietary intake and all is taken over during their breastfeeds and all by the children.
Right.
Now another factor is, there are a lot of hallucinations in the woman. If I take multivitamin at the age of 35, my weight will increase. If I take calcium and vitamin D supplementation, my weight will increase. All this is not true. If you take 1 calcium tablet a day, you keep a cycle for about, say, 20-21 days. Keep a gap of 10 days. And again restart the tablet. Okay. Now there are additional factors, like if that lady is a hypertensive, or nowadays thyroid is very high. So if the lady is thyroid, her calcium will start depleting.
Okay.
So they will not know. Then there are some other illnesses. Suppose like tuberculosis. Invariably nowadays tuberculosis, there is a lot of check by the government authorities. Okay. But all the patients who are having tuberculosis, they must take calcium tablets, because 2 of the anti-tuberculous drugs, they tend to deplete calcium from the body.
Okay.
So that is one more important factor, which is very important. Then I have seen, the working women who work for 8-10 hours, come back home, they again prepare their household work. These ladies are usually fit. But the young women who are housewives, okay, they just prepare the routine household work. These women, they are more prone to osteoporosis. And the simple reason is there is no physical activity,
right,
meaning walking. They don't come out of the house. These 2 reasons, the housewives are more tend to go into osteoporosis. But the working woman, she is traveling. Even if she goes by auto in the sun, railway station, she is exposed to some amount. She is walking. She is getting down the staircases at both the stations. So these women, usually their calcium is not depleted. The other factor is, nowadays there is a diabetes. So if the lady is diabetic at a younger age, she will be more prone for osteoporosis.
Okay. So, sir, what can we do to protect ourselves from osteoporosis then?
See, most important is, it's a big thing. Basically, once you know that your legs are paining, you are getting numbness in the hands or burning in the feet. Okay. When you are lying down on the bed and you are getting back pain, these are early warning symptoms of osteoporosis. Okay. So one should at least they start taking. There are some natural foods which will increase the bone calcium. So simple things. You take a glass of milk at night. The moment I tell this to the lady, "No, doctor, माझं वजन वाढलं. No, doctor, I am allergic to milk.
Lactose intolerant.
So can I take dahi? Can I take chas?" So usually 50% of the women are reluctant to take milk. So in night it is recommended because the absorption is 100%.
Okay.
Then you can have 1 or 2 walnuts, 1 or 2 akhrots, badams. So this increases or this makes the bones strong. Then there is something called as ragi. Ragi is thing which is the richest source of calcium. So you can have ragi in sort of make in a curry form, that paste type, and you can have ragi. This increases the bone calcium.
Okay.
Non-veg, you can have fish, which is good for bones. You can have, and obviously our supplementations, even paneer, that is a very rich source. Guava, these are the rich sources.
Okay. Sir, any exercises that you recommend for women जो हम कर सकते हैं to keep our bone health?
See, normally there are many exercises which are recommended. But simple exercises can be done at home. Most important is just keep walking. Walking is the best exercise to prevent osteoporosis. You keep normal walking from in your house, from bedroom to kitchen, kitchen to bedroom. That for 1 hour is enough when you are off the work.
Okay.
Or you can go, if you have time, early morning walk is recommended, then evening walk. A caution is walking should be done before meals. I have seen 20-30% of the population, they go after meals for walking, which is not recommended, especially in elderly women who are having hypertensive thyroid, because that gives more load on the heart.
Right.
So early morning walk up to 9:30, or evening walk between 6 to 8, then come home, then have dinner, is recommended. Walking is the best exercise for women. They can do treadmill if they cannot go out for around 40 minutes with zero inclination and speed of up to maximum 5. If they increase the inclination and speed, then they will tend to have knee pain as well as back pain.
Okay.
So they can do treadmill at home. They can do simple stretching, which we used to do in schools. Normal school exercises for the upper hands and all, even that will suffice.
Okay, sir. Sir, you mentioned about knee pain and back pain. Let's go on to the topic of old age orthopedic issues. With age, usually old age people, they come to the OPD and they say that we have got pain in the back or knee. Is this a sign of aging, or is it because of some lifestyle issues that they might be facing?
No. See, age, I have to tell the patient that you are old now. There are some percentage of people, they are not ready to accept that I am 70, I am 80. And they want to do the same level of activity levels which they were doing at the age of 50, 60. Okay. So first, this you have to make them put in their brains that you are an old lady, you are an old man. Go slow. Means it's a simple things. Then what happens if they try to do anything in hurry? They tumble, they fall, and they get fracture neck femur. So if there is a hypertensive patient, suppose 70-year-old lady, and she wants to go to washroom, so she is lying down. Now if she wants to go to washroom, she suddenly stands up, the BP will fall and she will fall.
Right.
So simple things. What is recommended? Sit for 1 minute, 1.5 minutes. Let your blood pressure get adjusted to your heart. Stand. Put the light on. And then walk. I get around 90% patients, old patients which have a fracture neck femur. They have a fall in the early mornings between 4:30 and 7. And then they are brought to my hospital at around 9:30, 10. And when I ask them, these are the reasons. They don't want to disturb the family, so they will not put the light on. So you cannot take a judgment
Right.
This is an empty space, now I am going to the washroom. No. So they have to put the light on. Thus invariably the space between the bed and the cupboard is less. So when they get up, they don't get the judgment. They are not putting the light on. They are likely to tumble and get a fracture neck femur or a distal end radius. So illumination of the lights at night when you are going for washroom is absolutely essential. Keep a ring. I have to tell, keep a bell. The nowadays cordless bells are available. Suppose if the patient is a fracture neck femur and she wants to go or he wants to go to the washroom. So keep one bell so that the person knows that mother is, my old lady wants something.
Right.
So he can get up and come, which is very essential.
Yes, sir. Why do joints, basically hip joints and knee joints, why are they suffering more wear and tear with old age than the other joints?
See, it depends upon how was your lifestyle, previous lifestyles.
Okay.
Okay. Hip joint and knee joint, they are the weight-bearing joints of the body. Okay. So whenever you are getting up, whenever you are sitting down, whenever you are walking, whenever you are squatting and getting up from the floor, the maximum stress is occurring at the knee and hip, followed by spine. Okay.
Right.
So if your entire lifestyle has gone in a farming, say up to 65 years of age, means what? 40 years they are squatting more than 100-200 times in a day, getting up, again squatting, getting up. Okay. Some patients, some people from there may get away with it because nothing will happen to them. But some people will tend to go into natural varus deformities of the knees.
Okay.
And once they come and sit at home for the normal chair or this thing, they will start getting the pain. So arthritis, everybody is likely to get arthritis. All age groups, all senior faculties, all whoever are working, means aisa nahi ki it will happen only with the working class. It can happen in even big people, all businessmen, everybody.
Something that is
The
inevitable.
degenerative evidence is a must. Now, the basic lifestyle structure is very important. Now, if we compare the foreign countries and India, the foreign countries, they have a lifestyle to jog.
Right.
Okay. I have seen, 80-year-old gender, male or female, they are absolutely fit. When I make it a point to ask them, what is your lifestyle? So then they say, so doctor, I get up every day morning at 5. I do my puja for 1 hour. Then I take my bath. Then I go for walking from 6 to 7. Then I have my breakfast at 7:30. Okay, I will have my lunch at 11:30. Then I will sleep for 1 hour in the afternoon. Evening food I will take at 8. At 9:30 I go to sleep. So if this sort of lifestyle previously people used to have, then they will not have any illness, because even if they go out of their regular house, outside country also, there also they will walk for 45 minutes.
Right.
Only the time lag. Now that is not to be seen now. I have seen a 80-year-old person coming, sitting, what is your age? 80. I only said, Salah, he is fit. Any illness? No, I don't have any hypertension, I don't have any blood pressure. Any other operation, they will say cataract surgery. But they are fit. Nowadays I am started getting knee pain. Then I have to put them in their mind, you are old now. Now don't sit down. Don't get up. They will stand on the stool to do some work in the house. Usually the stool tumbles. Then they get either a wrist fracture or a neck femur fracture. Why you did this? Then they suddenly they become absolutely psychologically unstable.
Oh.
So you have to tell them, you are old, stop this activity, don't do this. Then usually the son or daughter is a doctor, he doesn't listen only. We tell them, don't do now, you relax, you have done enough, watch TV, relax. But these old people, they don't listen. Then they land up with these problems.
Right, sir. Sir, So if they are getting pain, usually their knees, they get so worn out that sometimes they will have to undergo a surgery. So are there any options where they can avoid surgery? And what is that time when they should consider surgery?
See, knee joint replacement is a surgery. Okay, is to be purchased by the patient,
Okay.
not to be sold by the doctor. Meaning thereby, the patient should be fully aware what is knee joint replacement, what stress I am going to undergo, what rehabilitation I am supposed to do after the knee joint replacement. Everything the patient's counseling has to be done. It is not an OPD procedure where you come, I take an X-ray and I see a grade 3 osteoarthritis and I advise a knee replacement on day 1. No. Because the patient is not tuned for the surgery, means they get an atom bomb if somebody tells knee surgery on day 1. Now, the problem is because of the YouTube channel, I am not against YouTube channel, everything is available on any channels now. So, the good part of it is always said in the channels. Nobody tells the bad part. Okay. So, this is one surgery where patient has to tell me, doctor, now operate on me. Now sometimes what happens, because see, nowadays it is, everything is market driven. So, I don't fall in that group. Okay, there are many options which are there available. One of them is good exercises, physiotherapy. You can wear a knee brace, which will deload your knee by 50%. You are having viscoelastic supplementations, which can be taken every year, which really works for at least till for 5-6 years.
Okay.
So your age becomes old. If the age is more and you operate, the chances of revision are less. But if you operate a 50-year-old lady, she has to undergo second revision replacement in next 9 years or 10 years.
Okay.
Because of the activity levels. A 50-year lady will be more active, whereas a 65-year-old lady after the joint replacement will be less active. So that increases the wear and tear. Then again the revision total knee replacement comes.
Okay.
Because the joints averagely, if you replace, they remain for 10 to 12 years.
Achha.
There are exceptions which remain even for 15 years, but that depends upon the patient's lifestyle. How that patient takes the care of his knees. We advise all the patients not to sit on the floor, not to squat, sit cross-legged. But patients by default after 6 months, they sit themselves, they sit cross-legged. So all these activities, they tend to increase the wear and tear, howsoever good the joint may be or howsoever good the surgeon may be. But there are some factors in the patients which are responsible, they will take us for early revision.
Okay.
It is the story doesn't end once my knee joint is replaced, now I will never get knee pain. No.
That needs to be understood. That even after a joint replacement, it can wear out.
Yes.
Okay. So also the youth nowadays, they go to the gym and they do deadlifts, which I've heard is not really recommended because it can have a bad effect on your spine. Is that true, sir?
Yes. See, whenever anybody decides to go to the gym, you have to always start from low intensity programs to high intensity programs.
Okay.
Now what happens, everybody wants to become fit in a short span of life. I blame all this social media for it. That person thinks of somebody, I should have biceps like him, I should have this like him. It is not like that. It is whether you are going to see. I get many patients who have damaged their knee joints. I have seen at least more than 10 patients, they get hurt while catching the cricket ball and their thumbs have become crooked.
Okay.
Okay, they are somehow or the other managing. But they will play the cricket with the same intensity which they were playing when they were 18 and 19. तर म्हटलं आर यू गोइंग टू, म्हटलं आय आस्क देम आर यू गोइंग टू गेट प्रमोशन इफ यू आर अ क्रिकेट प्लेयर इन द कंपनी. नाही डॉक्टर. म्हटलं तू वाय यू आर डॅमेजिंग, यू हॅव गॉट अनदर 18 ॲक्टिव्ह years you have to work in the office here, your fingers have to work on computers. They don't, they will go. Then other problem is, with just a week back I had a young patient. Doctor, I am flying to US on 1st. Last week while football my knee is getting locked. First thing is don't confirm 1st January. Go for an MRI. Doctor, I don't think it is serious. You are doctor or I am doctor. After the MRI report, he only told, doctor, I have cancelled my US because I can't afford the surgery there.
Achha.
He saw meniscal tear, he saw ACL tear. So 3 months he is out. He cannot go to US. Then he should have not played. Then they will ask too many questions. What is my recovery period? How much? What will be? How many scars? इतना क्यों पूछ रहा है? नहीं सर, मेरा जॉब यूएस में 1 तारीख को मेरा टिकट है. So they should take precautions. Deadlifts and all, you should be trained for it. I have seen people breaking their clavicle bones. The weights they lift, it slips, it falls on their shoulder and they broke their clavicle. Okay, so all these things you have to do because see, trainer will advise you, but it is up to us how much to do. यार कुछ नहीं होता है, वैसा नहीं होता है, बहुत कुछ हो सकता है. I have seen people getting triceps tear after doing a heavy lift when they were doing triceps with a 30 pounds weight, and suddenly when he comes up next day he is not able to do this. फिर आया MRI किया, triceps is avulsed. Now it is surgery.
So do you think warm up and cool downs play a role?
Yes, they play a very important role. You have to learn how you do Googles for other things like that. You should even check in the Google what things you must start first, what things should come first. And gradually they want everything to be done in 3 months. Then they are going to get hurt somewhere.
Yeah.
That is the problem.
Right, sir. How can athletes protect their joints from getting worn out?
See, professional athletes who play for the clubs or countries, they are well screened, they are well educated, they have been taught how to prevent injuries, how to get minimally hurt when you are playing that particular profession. So they know everything. They are trained by the physios, they are trained by the international, national, state level. They have a in-house things which teaches them. Prevention mein most important is you must wear all the protectives. Now we have a knee guards which are there. We have ankle guards. He is wearing wrist this thing. You have elbow pads.
Right.
So suppose even if you fall, the level of the intensity of injury will be less. So protective wears they have to wear. That is one way to protect yourself from the thing. Now, another thing, a word, people are more prone to now go for marathons. I have done 10 kilometers, I have done 20 kilometers. So if you have not done anything in the life before, okay, now if somebody tells me, doctor, you take part in Powai marathon, my answer is no, because I have never done that before in my life. Now if I do that, even if I walk and go for 10 kilometers, I know I am going to get some issues next day or third day. Immediate issue which I can get is I might get an attack in between. And if you have read the newspapers, invariably after these long marathons, 1 or 2% sustains MI and they die before they reach to the hospital. So you have to be precautions. Suppose if you have decided to go for a long journey, say you have to climb, okay, you have to get your heart test and all done before you do those adventures. Without that, one should not take those risks.
Right.
I have seen many people, going this baseline of Himalayas, and they reach up, then they get respiratory problems, they cannot breathless, there is no team available, and the person just expires if there is nothing is available. If you are not trained, you have to go gradual. First 2000 square foot. आ जाओ वापिस 2 साल के बाद 3000. अभी सडनली somebody tells me, can you डॉक्टर साइकिल से तुम ठाणा जाएगा क्या? मैं नहीं जाएगा. But there are at the same time some doctors, there are some people who come from Nashik to Mumbai by cycle, but they are professional cyclists. They keep their driver and car behind. They know what problems they will anticipate. Suddenly if somebody decides कि नहीं मेरे को आज ये करना है, now there are few people, they go for this Sai Baba Dandi. They walk from here to Shirdi. Their bodies are tuned for those type of walks, breaks and all. But if a person has not done in his life and he suddenly tries to do this type of thing, see, you can pray God sitting in wherever you are. In between, anything can happen. If he is not used to, suppose he stops in between Nasik, उधर का cold climate है. If he doesn't understand anything, he may get, because of high climate only, उसको कुछ भी हो सकता है. So these things are very important. Traveling should be done in a broad daylight. People are more prone to drives as night, and invariably night driving lead to mishaps. So these things are very important. As far as the medical professionals are concerned, there should be, proper food habits. Nowadays, doctors are also careless. They don't take care of their own. So they should have a proper lifestyle. They should have proper sleep. And there should be empathy towards patients. That is very important. You have to tell the patient what illness you have, what surgery is done, what are its implications. All that thing is important. You just cannot come, oh, I want to operate, go do this, do that, and then you don't talk to the patient. That is not allowed. You have to bring the patient into full contact. The patient should have full trust on you. Then only you will get good results.
Yes, sir. So there are few common things like जो पेशेंट्स होते हैं वो नॉर्मली ना जो लोअर सोशियो इकोनॉमिक बैकग्राउंड से बिलोंग करते हैं, दे गो टू दीज प्लेसेस कॉल्ड हार्ड-वेड्स. हार्ड-वेड्स जो होते हैं, दे डू सम काइंड ऑफ मसाज और मैनिपुलेशन करके दे ट्राई टू फिक्स इट. तो सर, डू यू थिंक their work aligns with what an orthopedician does? Or
see, going to an Haad-vaids, is it is followed since ages in those particular people.
Yeah.
But it relieves their momentary pain. And the complications which arises because of that manipulation, okay, those are more expensive than going and giving 500 to that bone setter. So simple, if you have got an elbow injury and your elbow cut, it makes a slip, and they apply some lape and they put wooden sticks. I am feeling better. Next day evening he will get sudden onset of pain. He goes to the Haad-vaid. एक काम करो, Haad-vaid भी आजकल एक्सरे निकालते हैं. Then they will read the report. अरे बाबा मेरे से नहीं होएगा, अभी तो हड्डी के डॉक्टर के पास जा. I see a lot of Haad-vaid patients. And then when they come to us, so what thing would have happened with 2,000 or 2,500 rupees on day one? They end up spending, if there is infection, IV antibiotics, 50,000, 60,000. And sometimes what happens, if the fracture is in position, because of they manipulate it, the fracture gets displaced. Then some patients will require surgery. The chances of infection are high. The chances of myositis ossificans is very high. The chances of deep vein thrombosis is very high if the patient goes to the bone setter. So I will not recommend any people to go to the bone setter at all, especially after their back pulse. If you see how they manipulate spine, that is means it is very, by looking at it only one will get scared. They stand on your back those bone setters, and they will lift you from the shoulders, making some noise.
Okay.
So you imagine what can happen to all the ligaments and this thing of the momentarily, yes, you will get relief. Down the line, you are inviting many things. Unstable spine, listhesis, all these things can happen because of that one episode of going to the bone setter. There are now, if you search YouTube channels, doing this, kadak,
Chiropractic.
this. If you see, I forgot the place. The person has become quadriplegia, weakness in both the upper extremities, weakness in both the lower extremities.
Because of this?
Because of that.
Oh.
And most important factor nowadays, which I forgot to tell you, people have less time. So previously when I used to get an acute lumbago patient, I will advise bed rest for 1 week. So, sir, 1 week I can't sleep. But I make it 3 days. Sir, I will work for 5 days. Can I take 3 days after 1 week? No use. Okay, then I will take 3 days. Why that rest? That rest is important. Your muscles will relax. In that period now, another misconception is, nowadays what I have seen, people go first to the physiotherapist. They will treat as per their diagnosis. So they will do ultrasonic treatment, they will do manipulation, they will teach some back extension. After 1 week, 10 days, if they don't find any relief, then patients only start feeling, yaar, mera diagnosis is not proper. Now let us consult an orthopedic surgeon. Then they come to us. But by that time, suppose if something is small, and with physiotherapy, the patient doesn't know that problem might have aggravated. I have seen 1 or 2 patients receiving physiotherapy for 2 weeks, 3 weeks. The patient told, no, doctor, I am not getting any relief. Okay, you do one thing, get one X-ray and show me. Physiotherapist only advises the X-ray. They took the X-ray. After reading the X-ray, the physiotherapist was scared. No, you immediately go and show a spine surgeon or an orthopedic surgeon. And the patient had a tuberculosis of the cervical spine.
Oh.
So, just depending upon the symptom, without knowing the diagnosis, you can't give exercises and IFT and ultrasonic treatment or anything. What is your neck might be sprained, but there are so many causes. I am not against physiotherapist, but a proper diagnosis has to be there, no?
Right.
Without proper diagnosis, how can I advise physiotherapy? And why they will also do physiotherapy without knowing anything? So this is a very important factor. This is, unfortunately, it has increased last 4-5 years. Doctor, I went to the physio, but my problem has aggravated after physio. This also patients tells us. Then I tell, you are a educated illiterate. I tell them, bluntly I tell them. I prefer to, people who are illiterate, they know, let us go and do the diagnosis. Let us do our X-ray. And then if doctor advises, then we will go to the physiotherapist. This is a very important factor. Means I am not blaming them, but this is because the social media. They try everything they try to do at home. I will get a heating pad, I will get a IFT machine. They themselves also sometimes they do. They will make for this frozen shoulder, they will make a hole in the bone and they will start doing. But तुम्हारा diagnosis क्या है? कुछ भी पता नहीं है. और मला फ्रोझन शोल्डर आहे डॉक्टर, मी व्यायाम बिम केला, पण आता ना आवाज येतो, then they will come to the orthopedic surgeon. But suppose if you would have come 2 months before, a simple rotator cuff injury could have just managed with a sling for 2 weeks. In that he is doing physiotherapy. So the tear becomes complete. Now there is no other choice. If he is a demanding patient, we have to go for shoulder repair.
Shoulder replacement.
Tear repair.
Tear repair. Okay. Also, sir, some people they massage their joints. Do you think that's a good way
See,
to
a
elevate?
gentle massage after hot water fermentation is recommended,
Okay.
but not a massage from a professional masseur. That is not recommended. Because they also do at times very hard. Momentarily you feel good. I am feeling relaxed. Yes. But there are problems which, if any problem has to take place, it can take place after 2-3 days.
Okay.
Swelling. After 3 weeks, he may get suddenly pain, swelling, and there can be myositis. I first tell them to do hot water fermentation for 20-25 minutes.
Okay.
Then I tell them to wait for 10-15 minutes. Take small quantity of the ointment and gently rub over the knee joint and leave it after 5 minutes. Bas.
Okay.
Not to do deep this thing.
Also, sir, sometimes we get sprains and pain. So, when should we do hot fermentation and when ice?
Any injury, any pain post-injury,
Okay.
post-injury, post-fall, always ice fermentation.
Okay.
It's a good question. Half the people do hot fermentation. They will apply haldi, they will apply some lep, and after 4 days, the swelling increases. And then they come to us. So just because of hot fermentation, no, it can lead to cellulitis and infection. If the patient is diabetic, still worse.
Oh.
So if somebody falls and gets pain in the knee and swelling, only ice packs. Only ice pack. Hot water is not recommended post-fall, post-injury.
Okay.
Only ice.
All right, sir. Sir, do you think vegetarians or non-vegetarians are more prone to bone health issues?
No. Statistics says that non-vegetarians usually have less amount of osteoporosis than the vegetarians.
Okay.
But per se, it doesn't make any difference. I have seen osteoporosis or osteopenia in the non-veggers. This thing as well as in the veg.
Vegetarians as well. Okay.
But the non-veg usually people they have a lesser amount of osteoporosis.
Okay, sir.
The degree of osteoporosis.
Okay, sir. Sir, any common sports injuries that you come across in young age people?
The type of patients which I get are usually taking catch, cricket ball. Then I get people playing football having knee joint injuries. Then I get people with ankle injuries.
Okay.
These are the commonest injuries I see following sports. And few of them I get patients of back pain. But the incidence of more is in knee and hand, followed by ankle and then back.
Okay. So, sir, for minor injuries, how can someone determine that they should self-treat or they should visit a orthopedician?
See, if there is swelling, excess pain, and suppose if it is a cricket ball injury, you are not able to do the adequate movements of that particular finger, always better to go to the consultant, take one X-ray or let the consultant see. If he feels X-ray is advised, let him take the X-ray and start the treatment.
Okay. All right, sir. Sir, any examples of effective exercise routines that you could suggest for the audience?
Basically, one should keep his body toned. So his normal activities should be done on regular basis. Like suppose if I have to talk about elderly people, and they should keep their walks regularly. They should do Om, chanting of Om.
Okay.
So sort of self meditation. Then they should do half squats, which will keep their lower limb, knees intact. Okay, I am telling you all the home remedies.
Okay.
They can, if it is possible, they can just climb their staircase 3-4 times, stand up. That is a exercise which is best recommended. In that, if you are not getting breathless, that means your heart is intact. Okay, so these things you must do on daily basis. Stand still leads to issues. If you are not moving out of the bed for XYZ reasons, and then suddenly you stand, you will find it very difficult to move even your ankle. Deep breathing exercises, which is important, and most important, be positive. Don't keep on thinking. What happens? Some patients' knee joint replacement has failed, and if some patient is likely to undergo a knee joint replacement, and this failed knee joint surgery meets this patient, this patient who is supposed to get operated will never get operated.
Right.
This is again which I have seen quite frequently. Deep breathing exercises, regular walks, half squats, just meditation for 10 minutes. All these things are enough for elderly patients. And for younger patients, whatever they do, they should do it under control. It should not be too over. Few people I have seen, excess biceps lifting, they have come with a biceps tear also.
Oh.
Which is a major surgery. He is out of work for 3 weeks, 4 weeks.
All right, sir. So we've come to the end of the podcast.
Okay.
Till now, we've basically addressed the common public. But this last thing I would want to ask you is, what advice would you want to give to the aspiring orthopedicians?
To aspiring orthopedicians, first thing is there should be dedication to the subject, number one. They should work sincerely, irrespective of what is the time. They should have empathy towards patient. They should do regular reading of the subject, and they should stay focused till they pass. These are the 5 things they must do.
And what do you think about the field? Do people should come for ortho or?
See, the type of residents which I have seen in last 35 years, okay, I have worked in a government college, I have worked in a semi-government college, and last 18 years I am working here. There are few residents which I have seen, they are interested in doing ortho. There are few residents who have come because they feel that the money is more in ortho. Means right now I know at least 2-3 residents of mine, they are not practicing.
Okay.
They are doing gym. So if they have taken orthopedics, then they should be focused, or don't take orthopedics. And orthopedics is a volatile subject. It is not as if you read last 2 months you will pass or you will be a best orthopedic surgeon. But they should be focused to the subject. They should read on regular basis. They should have a sympathy or empathy towards patient. They should respect the seniors. And till they pass, they should be focusing on orthopedics. Afterwards, they can decide their specialization. Nowadays, the trend is, the moment 6 months happen, they start dreaming, I will become a replacement surgeon, I will become an arthroscopic surgeon, which is not thing. For that, you have to know the basic orthopedics. That is very essential.
Okay, sir. So we have come to the end of the podcast.
Okay.
Thank you so much. Thank you so much, sir, for being my guest today and taking out time from your busy schedule and coming on to this podcast today.
Thank you.
Thank you, sir.
Thank you for watching this podcast. I hope you all enjoyed it. Till then, like, share, put your thoughts in the comments below, and don't forget to subscribe to my channel, DoctorSaab.